Welcome to Providing Emergency Care, a review of first aid and wound care, brought to you by American Way University. My name is Angie Danielski, and I have developed this course as part of continuing education hours required for caregivers in the assisted living setting. In Part 1 of the presentation, we will discuss what to do before providing care, including a caregiver's role in an emergency. Next, we will discuss providing care for residents and checking an unconscious resident. In Part 2 of the presentation, we will discuss sudden illnesses, including chest pain and heart attack, breathing emergencies, stroke, seizures, and diabetic emergencies. We will also discuss weather-related emergencies. In the third part of the presentation, we will discuss soft tissue injuries, including wounds, burns, and sprains or strains. We will also discuss focusing on prevention with elderly residents. Before providing care, it is always important to consider your own safety so that you yourself do not become a victim. When approaching a potential emergency, check the scene and make sure it is safe for you to enter. Additionally, make sure you wear gloves and other personal protective equipment as needed. When you have recognized that an emergency exists, call 911 or activate your emergency response system. Then, you should assist residents as needed. As a caregiver, your role in an emergency is most importantly to recognize that an emergency exists and to decide to act. Next, you should activate the emergency response system and then provide care until emergency personnel arrives. Once the ambulance arrives, ensure that you are providing any pertinent information to emergency personnel, including what the normal level of consciousness is for that resident and what has occurred in this situation. When caring for a resident who is having an emergency, do not move the resident if you suspect they have any head, neck, or back injury. If this occurs, check the resident for level of responsiveness and simply stay with that resident until emergency personnel arrives. If the resident is able to answer questions, ask the resident questions to determine what occurred and if the resident is experiencing any pain or illness. If a resident is not able to respond, quickly examine the resident from head to toe to check to see if the resident is breathing and also if there is any obvious bleeding. Position the resident on their side if any fluid is draining from the mouth. Provide any appropriate care that is within your scope of practice as necessary. When providing care to residents, one of the most important things that you can do is to check to ensure that the resident has an open airway and that the resident is breathing. If the airway is not open, reposition the head in an attempt to open the airway again. After scanning the resident for injuries or bleeding, as we learned in the previous slide, control any bleeding that may be present and stabilize a limb if it is injured. Place the resident in a position of comfort until emergency personnel arrive. Again, if a resident has any fluids draining from his or her mouth, place the resident on his or her side. When approaching a resident who is laying on the ground, approach the person from the front to check for level of responsiveness. In the event that the resident has injured their head, neck, or back, it is important that you approach from the front so that the resident does not have to turn their head. Next, you should turn the resident over if they were laying face down. Ensure that you do not roll the resident over the face and that you protect the head and neck when turning them over. Once a resident is on their back, perform the head tilt, chin lift maneuver to open the airway and check for breathing. Look down the chest to look for chest rise and fall. If you have to leave a resident for any reason, or if the resident begins vomiting, place the resident on their side in the recovery position. You have reached the end of Part 1 of the American Way University training of Providing Care in an Emergency, First Aid and Wound Care Review for Caregivers.